name is Kristen Stakelin, and I am the medical director here at the Barnstable Brown Diabetes and Obesity Center. Actually, I have been interested in being a doctor for as long as I can remember. I mean, I said that from when I was really little. My whole family remembers me saying, so I don't remember not saying that. It helped that my favorite subjects were math and science. So my mother's a nurse, so I used to, when I was little, I would go to the hospital with her a lot, and I don't know if they still have candy stripers, but I was a candy striper for a number of years at the hospital where she worked, and so I've just always thought I would do that. But I do just adult diabetes care, so that can be type 1 diabetes, type 2 diabetes. It can be folks who have diabetes because they have cystic fibrosis, gestational diabetes, post-transplant diabetes is actually a fairly common thing, so I see some of that. You can come here for just education. You can just learn some things from a nutritionist or a dietitian, or how to take better care of your diabetes. Or you can see a provider who specializes in diabetes beyond what your primary care often has time to do. So we have diabetes educators in every clinic, so they are available at any clinic visit, which is fantastic and helps us run the clinic well. Now that we are all under one roof, we have pediatrics and adult, and I love that we can all be one team and you can transition from childhood to adulthood if you have type 1 diabetes without a gap in your care, and plenty of research goes on here. And so we get to be a part of the research sometimes in clinical trials or studies, but we at least have access to research that's ongoing. With academic medical centers, you always have learners around, so residents and students and fellows, and you've got to stay on your toes to be able to teach, you know, the most current and evidence-based medicine. So it's easy, I can speak from prior experience in private practice, it's easy just to get set in your ways and not always be as sharp as you should be on the most current issues. But when you know that a student is going to ask you about an article they just read, you better know what they just read. You may have the world's most excellent primary care physician, but they've probably got about 20 minutes to take care of your diabetes, your hypertension, your lipids, your asthma, your depression, your back pain. And here we've got all the time for the visit focused just on your diabetes care. Part of what I really like to do is to sit with the patient and say, this isn't black and white. We can go with this set of choices or this set of choices. Here's the pros and the cons. What seems to fit best in your lifestyle? But I have the time to have that conversation with the patient, and so do the diabetes educators that are here. I am a huge advocate of patient rights, and I love just sitting and listening to patients. Sometimes that gets me in trouble and I run behind in clinic, but one of my favorite things is to just hear their story, more than just their disease itself. Like, where do you live and who lives with you and how does life work for you? How busy are you? What access do you have to supplies and medications and even food? And what stressful things happen in your life that keep you from testing or taking your medication? And, you know, rather than just chastising someone for being non-compliant, you know, getting at the root of what makes this difficult. I mean, this disease is far-reaching and can be sneaky, and there are more than just black and white reasons why patients are not always doing well. And so I really love to just sit and talk. So.